While Felix test uses Proteus OX19, OX2, and OXK antigens to detect heterophile antibodies in suspected infections. Rickettsial. Scrub typhus eschar is pathognomonic for infection by Tsutsugamushi, Orientia, formerly rickettsia. Doc for scrub typhus in adults is doxycycline 100 mg BD for ? 7 to 10. Rocky Mountain spotted fever rash classically begins on wrists, ankles, and involves the following surfaces of limbs, palms, and soles. Rickettsia prowazekii epidemic typhus is transmitted by the human body, louse, Paticulus humanus corporis. The vector of Indian tick typhus, R. canorii, is tick, Rhipicephalus sanguineus, brown dog. Transovarial transmission in ticks is characteristic of group Rickettsiae, spotted fever. Q fever presents as atypical pneumonia. The causative agent Coxiella burnetii is diagnosed serologically by rise in IgG antibody to phase antigen. E. Coxiella burnetii is resistant to heat and desiccation because it forms spore-like bodies, small cell variant, SCV. Trachoma, leading cause of blindness, is caused by Chlamydia trachomatis, serovars, trachoma 2, A, B, BA, C. Chlamydial elementary body is infectious and metabolically inactive. Azithromycin, single dose, 1 gram orally, is first-line therapy for uncomplicated urogenital infection by C. trachomatis, serovar, unquestioned, D.K. Lymphogranuloma venereum bubo-suppuration is produced by C. trachomatis, serovars, L1, L2, L3. Inclusion conjunctivitis in neonates manifests typically on day 5 days after birth, day 5 to 14. Chlamydia pneumoniae is associated with atypical CAP and is cultured in X cell line, HEP2 or HL cells, HEP2 accepted. Psittacosis is acquired from parrots. The etiological agent is C. psittacosis and responds to antibiotic group. Tetracyclines, doxycycline. C. trachomatis lacks muramic acid in peptidoglycan, hence cell wall is deficient, and grand stain shows no reaction. Typical, very faint. Mycoplasma pneumoniae possesses a membrane-sterile binding protein called SET, which mediates attachment to ciliated epithelium. P1 adhesion. M. pneumoniae cold agglutinin test detects auto-IgM antibodies agglutinating human antigen, I antigen on RBC. Doc for M. pneumoniae pneumonia in children is a B-class antibiotic, macrolide, azithromycin, erythromycin. Mycoplasmas lack inner cell walls, making them intrinsically resistant to beta-lactam antibiotics, peptidoglycan. Fried egg colony appearance on PPLO agar after 5 days incubation is typical for species, Mycoplasma hominis and M. pneumoniae. M. hominis is unique among mycoplasmas in being inherently resistant to macrolides but susceptible to clindamycin tetracycline. Ureaplasma ureolyticum requires supplement in culture medium for growth, urea and cholesterol. Genital mycoplasma colonization during pregnancy is linked to preterm labor, particularly with species Ureaplasma ureolyticum and M. hominis. Chlamydial inclusions in McCoy cell monolayer are best visualized by staining with iodine, Lugol's iodine, glycogen. The major outer membrane protein, MOMP, of chlamydia determines specificity. Serovar antigenic. While Felix test false negativity occurs because OX antigen shares only antigenic epitopes with rickettsia, heterophile, limited. R. acari mite-borne rickettsial pox presents with vesicular rash mimicking infection, chickenpox, varicella. Chlamydial EB to RB differentiation occurs inside host cell within 6 hours post-entry, 6 to 8 hours. Q fever chronic endocarditis requires long-term combination of doxycycline and for 18 months. Hydroxychloroquine. Transstadial persistence, but not transovarial, occurs in Burnetti-infected ticks. Coxiella. Molecular detection of R. cannori uses PCR targeting the gene, outer membrane protein, OMP-A, ONC-B. Murine typhus is caused by rickettsia transmitted by rat flea Xenopsilla chiopus, R. typhi. Jerish-Herxheimer-like reaction can occur after doxycycline therapy in severe problem infections, rickettsial, especially RMSF. Direct fluorescent antibody test on skin biopsy of rash is specific for diagnosing spotted fever, Rocky Mountain. Mycoplasma genitalium is detected by NEAT targeting the NAT gene, MGPA adhesin 16S rRNA. Treatment-emergent macrolide resistance in M. genitalium is due to mutation A2058GC in blank rRNA, 23S. LGV presents initially as small painless ulcer followed by femoral inguinal BAM, sign, groove lymphadenitis. C. trachomatis induces reactive arthritis in HLA-B27 positive males, formerly called syndrome. Writer. M. pneumoniae extrapulmonary complications include hemolytic anemia due to antibodies, cold agglutinin, IgM. Rifampicin has in vitro activity against C. burnetii and is alternative for treatment in women. Pregnant. Pneumonia's polar tip organelle contains cytoadherence proteins and is essential for AD2 to host cells. Attachment. Species R. africae causes African tick bite fever. The typical inoculation lesion is called escar, tache noire. Serological diagnosis of psittacosis requires fourfold rise in complement-fixing antibody against antigen. C. psittacocci, phase 1. Sulfonamides worsen rickettsial diseases by increasing moribund rickettsial replication, paradoxical. Mycoplasma cell membrane contains sterols obtained from in culture medium, serum, horse serum. TEM reveals that rickettsia replicate freely within host cell, unlike Coxiella. Cytoplasm, not phagolysosome. Coxiella burnetii is classified as Category Bioterror Agent, CDC, Category B. Antigen detection in scrub typhus escar biopsy uses immunohistochemistry. Leptospira-specific? Actually, Otsutsugamushi, IHC. Vaccine for RMSF is not available. Prevention relies on colon control, tick bite, vector. Macrolide azithromycin is preferred over doxycycline to treat scrub typhus in ? and children 8. Pregnancy. PCR for rickettsia includes nested approach using primers for citrate synthase gene, GLIT-A. Cold agglutinin titer significant for mycoplasma is greater than or equal, at 4 degrees, 164. PPLO agar contains indicator which turns yellow due to glucose fermentation by M. pneumoniae, phenol red. Mycoplasma contamination in mammalian cell culture is detected by DNA stain, Hoechst 33258.B. Chlamydia is obstinate to gram stain but shows basophilic intracytoplasmic bodies on Giemsa, inclusion. High iodine content of C. trachomatis inclusions denotes accumulation of R in RB stage, glycogen. M. hominis has the smallest genome among free-living organisms at MB megabytes, 0.65 megabytes. Treatment failure in C. trachomatis due to persistent aberrant RB form is addressed by longer therapy, doxycycline 21 days. Chlamydia vaccine trials target PMPD and conserved epitope of MOMP. VD4 variable domain 4. Rickettsia cannot synthesize acids and derive them from host cytosol, hence obligate intracellular, amino, and nucleic. Rapid immunochromatographic assay for scrub typhus detects IgM antibodies to 56 kDa. Tite-specific outer membrane, TSA 56. Obligate intracellular energy parasite nomenclature for chlamydia indicates it depends on host ATP, termed ? Energy. Ixodes scapularis transmits Tres paste and Babesia alongside Rickettsia species, Borrelia burgdorferi. Azithromycin single dose 1 gram is inadequate for M. genitalium. Current CDC regimen is 1 gram, then 500 milligrams daily 4 days. 3 days, total 1.5 grams. STEEK, prosody rate 120%. Trachoma elimination target, GET 2020, AINS TF prevalence, about 1 to 9-year-old children, SAR. 5%. 5%, SAR. SAFE strategy for trachoma stands for surgery, antibiotics, facial cleanliness, and improvement, environmental. DNA staining differentiates M. hominis blue from ureaplasma, brown-yellow. C. pneumoniae antibody microimmunofluorescence acute titer greater than 1 to 28 or 4-fold rise confirms recent infection. Chlamydophila pneumoniae. Obligate intracellular bacterium orientia lacks polysaccharide typical of other rickettsia. Peptidoglycan and LPS. Mycoplasma fermentans utilizes sugar fermentatively, producing acid, glucose. PCR RFLP-OMP-A gene allows differentiation of R. conuri subspecies such as israelensis causing typhus, Israeli spotted fever. Doxycycline PEP 200 mg once within days after high-risk tick bite prevents RMSF. 5 days, preferably 3. Mycoplasma cell culture requires agar supplemented with 20% blank agar serum for cholesterol. Horse. C. psittaci infection in birds causes green droppings and is excreted in dust, transmissible to humans. Feather fecal aerosol. Sequelae of LGV anorectal syndrome include chronic stricture, rectal. SPEAK, the score predicts mortality risk in viral pneumonia including C. pneumonia co-infection. L stands for lymphocyte count. Subject parentheses, 800 milli. Treatment of neonatal conjunctivitis due to C. trachomatis uses oral for 14 days. Erythromycin. Placenta infection with C. abortus causes enzootic abortion and use. Zoonotic infection in pregnant women may lead to expodal outcomes. Fulminant sepsis abortion. Ureaplasma urealyticum splits urea producing ... which can damage lung epithelium in neonates. Ammonia. Headlight in fog appearance on fluorescein angiography is diagnostic of ocular infection. Toxoplasma, but not chlamydia. Skip. Endocarditis agent Bartonella henselae resembles rickettsia, but is gram-negative and treated with plus rifampin, doxycycline. Leptotrichia bocalis is a wall-less bacterium resembling mycoplasma found in flora, oral. PCR positivity for C. trachomatis persists for up to 3 weeks post-treatment, hence test of cure advised after 4 weeks. R. parkeri rickettsioses produces eschar and rash and responds rapidly to therapy. Doxycycline. Beta-lactams are ineffective in mycoplasma infections because they target synthesis. Cell wall peptidoglycan. Pneumonia due to M. pneumoniae is also termed blank pneumonia, walking atypical. Chlamydia trachomatis genital infection can be prevented by screening all pregnant women during this trimester. First, tetracycline resistance in U. urealyticum mediated by TET-M gene carried on transposon, TN916. Doxycycline contraindication in children 8 years older than 8 is circumvented by using, for rickettsial infection, azithromycin. Rickettsia have leaky cell walls allowing staining with unstain, giving red microbes on blue background. Gimenez. PPLO stands for pneumoniae-like organisms, historical term for mycoplasma. Pleuropneumonia. C. pneumoniae, TWAR strain, is transmitted human to human via droplets. Respiratory. Phase 1 Coxiella antigen is smooth, virulent. Chronic Q fever endocarditis shows high antibody to phase 1, more than 100/800. IgG. Mycoplasma penetration factor generates reactive oxygen species damaging epithelium, respiratory ciliated. Chlamydial cell wall contains cysteine-rich proteins conferring rigidity, outer membrane proteins, OMPs. Human placenta trophoblast invasion by C. trichomatis may trigger preeclampsia through release of cytokines. Pro-inflammatory, IL-6, IL-8. Treatment for doxycycline-resistant M. genitalium utilizes oral 400 mg daily plus doxy 100 mg BID, moxifloxacin. The whale Felix OXK agglutination at more than 320 strongly suggests scrub typhus, whereas OX19/OX2 positivity suggests typhus, epidemic, murine, classical.